I really think that one of the things that has to happen is that the consumers of healthcare have to become more involved in what they're consuming. And so they have to understand it. They have to feel comfortable talking to healthcare providers about the treatments and the medications and the recommendations that they're being given by those health providers, and asking about what the alternatives are. There are a couple of, I think, key things. One is that we do need to really start making the cost of care transparent. So although it's going to be difficult, our members hopefully will be able someday to go and see what a service might cost in one location as compared to another. Okay, and that can't be confusing to them. I think we have a way to go to make that happen, but we're committed to make that happen. I think as a profession, we're smart enough to figure out how to continue to do our work, have our own professional satisfaction, and to improve the health care for all the folks in Maine without breaking the bank. I think that's the key. More and more, I've been spending time talking to patients about the fact that in their relationship with the medical profession, they're really the customer. And so they should expect to be treated like any customer when you're buying any service, and that you should be able to ask questions. You should be able to ask what are the alternatives. And if you don't like the answer you get from one physician, it's certainly okay to get a second opinion, to go get an answer from another physician. And I think that I really try to get patients to be their own advocate. I think in one way, we're going to try and make it easier financially for patients to get care that has been shown to be very helpful in terms of their outcomes. I think patients need to know what the effectiveness is of the various treatments that they can choose, the various costs of those treatments, and then make a decision about which one they really want to have. We, as medical professionals, are not, immune to the same pressures the patients have, right? We see our health insurance going up. We have families who interact with healthcare, so we all understand this. And I think that it's happening somewhat automatically, I guess. For a lot of folks, I think our role is to try to help guide the process and educate folks and answer, be there to be helpful, as we all go through this transition.